Good morning, everyone. Thanks for joining us this Friday in August. I'm Tara Bell from Smoke Free SC. Thank you again for joining us. We're excited you're here, and we're excited to have Michele Brown from the South Carolina Department of Public Health, formerly South Carolina DHEC, joining us this Friday morning. I'm going to pass it over to her and let her introduce herself. As always, we'll have time at the end for questions, and also the meeting is recorded, so you can come back and watch it later on our website or share it with anyone who you think needs to see it. So thank you, Michele. I'll hand it to you.
Thank you so much, Tara, for having me. And also thank you to Deborah for reaching out to Mike Treadway, who is our director at the section of oral health at South Carolina Department of Public Health. I got to get used to saying that because that is the new the new wording instead of DHEC. It's so easy to come off the tongue. But I'm super excited to be here today. So as Tara mentioned, my name is Michele Brown. I am a licensed registered dental hygienist. My background's in pediatric and public health. And to have pediatric, public health, and oral health all in one job within the section of oral health is like my dream. I love anything kids, public health, and oral health. So I'm super excited to be here today. I'm super excited to spread some knowledge about oral health and smoking. I know before that we've had some relationships and ties with the section of tobacco. And since I've been here in 2021, we have not had anything official since then, but we are constantly talking to that department and or section. Got to get used to saying that section, and super excited to hopefully partner up with them one day. But I'm excited to give y'all the information here that I have, and I do want to be clear that because we are not lacking in information, but I feel like we can be more robust. A lot of the information that I am sharing today is from the American Dental Association, which is ADA. And they have a pretty cool branch off called Mouth Healthy, which I recommend that all of y'all take a look at because there are different topics and different things in regards to information on specific topics such as whitening and cleanings and x-rays and all the things that even a clinician might have and need questions to be answered to, or even a civilian. So it's a great resource. I definitely put the information at the end of my slide deck here for y'all to check it out. But again, let's get going. Smoking and oral health. That's my box here. Okay. All right, so tobacco use and oral health facts. So these are just a few things from CDC that I wanted to share with you guys. Some facts about using tobacco and oral health. And so there's cigarette, smokeless tobacco, and other forms of tobacco that causes oral cancer, gum disease, and other health problems. Untreated cavities, which is called tooth decay, are higher in people who smoke cigarettes. Over 40% of adults aged 20 to 64 years old who currently smoke cigarettes have cavities compared to those that do not smoke at all, which is 20%. Adults age 65 or older who smoke cigarettes are twice as likely to have untreated cavities as those who never smoke. In that same age group, about 43% of those people who currently smoke cigarettes have lost all of their teeth. And I will say this is a personal story for me as well, is because my father, he is a tobacco user and has been since he was 12 years old, unfortunately. And he has fallen into this bracket of people. He's over the age of 65. He's currently a cigarette smoker and has lost all his teeth. And I'll share some more information about what that looks like for a smoker who has lost their teeth later in the presentation. But it's easy for him to fall into this category as well. So it's a personal story here, and I can attest to the day-to-day of it. Smoking or using smokeless tobacco increases the risk for oral cancer and other head and neck cancers, which we'll go over briefly. And healthcare providers in a variety of settings play a critical role in helping people quit using tobacco. And what that means is not only is there an opportunity for those that are trying to quit smoking to go to their medical providers, but the dental office is also a great place to go to as well to get resources to talk about quitting smoking and to know what to look for when you are a cigarette smoker. So let's move on to the next. So the ADA classifies nicotine-containing products as cigarettes, cigars, pipe tobacco, hookah, roll your own tobacco, smokeless tobacco, dissolvables, nicotine gels, and any electronic nicotine delivery systems such as e-cigarettes, e-hookah, vape pens, e-pipes, all of those things. And they like to say and be it further because there are things that are out there, I'm sure, that we are not aware of yet, but could be possibly added on this list. And so that's how ADA kind of tailor their information to these nicotine containing products. So anytime that I have an opportunity to yell off the rooftop, I absolutely do. Good oral health leads to good overall health. And what that looks like is that your teeth in your mouth are the gateway to your whole body. And what you feed yourself and what you put into your body through your mouth affects overall health. And so healthy teeth, what that looks like is just, it helps us speak clearly. It supports our jaw health. Because believe it or not, your teeth sit in bones and your bones sit in your jaw area, and that helps your jaw health. Assisting in chewing your food thoroughly is essential for good digestion. Chewing that food, that is what your teeth do. And that helps when everything digests throughout the whole body. And it looks good. Let's be honest. If your teeth look good, there's a great source of confidence that you have about smiling and speaking to other people, interacting, being more social. It actually leads to working out a little bit more. It also leads to doing better in school, missing less work hours, missing less school hours. So having good oral health leads to good overall health. So what happens inside a smoker's mouth? So I told you guys my background. I'm a pediatric dental hygienist, but I've worked with adults as well. And believe it or not, in pediatrics, we're having this conversation earlier and earlier and earlier with their parents. Some of the things that you can look for when you when you are a smoker, the things that you can look for are very clear as a clinician. Um, that things change as far as like the way your teeth looks, the way your teeth functions, even the way that you chew and eat your food, enjoy food. Some of those things are tobacco stains on your teeth and tongue. You'll see that yellowing, that browning on the teeth. You'll actually see a coated tongue. You might see when someone talks, there's like a white patch over their tongue that could be white, yellow, or brown. You also have smoking that dulls your senses of smell and taste. It makes dishes that you normally like less favorable and less pleasurable. Cosmetic dental procedures such as teeth whitening, there's actually no reason for you to do it because if you are smoking and you still have those tobacco stains on your teeth, cosmetic dental procedures are very hard and ineffective over time. And I will even go on to say that there are certain procedures such as implants, if y'all are aware of, where you actually replace the whole tooth structure and put it into the jaw and start a brand new tooth if that makes sense. Well, a lot of people that want to have an implant, you cannot get an implant if you are a smoker because it proves to fail, it proves to not work, it proves to not sit in the bone correctly. So that's another cosmetic dental procedure that will not be approved by insurance, even if they find out that you are a cigarette smoker. And smoking causes chronic bad breath, which can also be put, again, a dent into your confidence. So those are the things I look at. And believe it or not, I started looking at those things middle school, high school, college age kids, and even when I did work with adults as well. So this is a heavy slide, but I want to hit on the points that are very important. Some of the serious dental issues developed for smokers is the flow of saliva. And so what that is TMI, like a better word, spit. So when you smoke, your flow of saliva, your spit is reduced greatly. And so what spit naturally does, what your saliva naturally does, is it actually cleans off your teeth from cavity causing bacteria. It also keeps your mouth from not being dry. It carries your food to one place to the next as you chew it. It helps and assists with chewing. And when you have when you have a lack of flow, it's dry mouth, and that definitely changes some things when you are a cigarette smoker. It definitely makes things a little bit difficult for your teeth and for your health. The chemicals that are found in tobacco smoke irritates your gums and the lining of your mouth, which leads to gingivitis, which everybody's heard gingivitis. The good thing about gingivitis, if I must say so myself, is that it's reversible. In the early stages of gingivitis, you'll see the red puffy gums, the tenderness, the bleeding of the gums. Gingivitis is something that if you actually brush and floss every day, and then go to a dentist regularly every 6 months to make sure that you're properly being cleaned and taken care of at the dental office, then gingivitis can be reversed. In this case, with cigarette smokers, believe it or not, one of the indicators when I clean teeth is if I see the enamel is yellow and brown, the tongue is patchy and colored in brown, they have red puffy gums, and they have tenderness around their gums. But here's the thing with cigarette smokers, a lot of times their gums do not bleed, and that is a sign that there is some kind of smoking habit that's taking place with this individual in my chair. So gingivitis usually leads to bigger issues. If the issues continue, your gums can pull away from your teeth and form spaces called deep pockets, where infections can develop. And what that is a form of periodontal disease, periodontitis. And so what that means is at that point, when you have the gum tissues to pull away from the teeth, then what that is that you are actually experiencing bone loss. And with any bone loss, you can't recreate bone loss. Once you start to lose that bone loss in your jaws and around your teeth become wiggly and they may fall out. So again, it goes back to when I was saying my personal story with my father, my dad, is that he has dentures because was not able to keep up the good habits that took to take to keep your teeth. Y'all always hear this the saying, brush all the teeth that you want to keep. So it's really very much taking care of your teeth every day, going to the dentist, and quit smoking because the smoking irritates your gums and affects your teeth and oral health in a negative way. Missing teeth can threaten the health of all of your remaining teeth. Things start to shift, things start to move. The bacteria that was on one tooth can go to the next tooth. And in fact, smokers are 3 times more likely to lose all their teeth than non-smokers. So this is a very important slide. I know it's kind of heavy, but I really wanted to share it with you guys, the process of how serious it can be. And so beyond the mouth, how dental problems affect your total health. So smoking can cause life-threatening cancers of the mouth, throat, tongue, or jaw. And I'm pretty sure a lot of other cancers are part of the body, which I'm sure you all are way more familiar with than I am. But quitting will reduce your risk for 12 different forms of cancer. The major risk factors for oral cancer and oropharyngeal cancer are tobacco use, alcohol consumptions, and the interactions between the two and heavy usage. That is the major risk factors, one of the major risk factors. I did put this picture here on the slide because there's a difference between oral cancer and oropharyngeal cancer, just slightly. A lot of times oral cancer involves your structures that are above your tongue, and oropharyngeal is from everything from your tongue to your back of your throat. And so it's very important to kind of distinguish between the two because although they are very connected, you can have oral cancer, and you may not have oropharyngeal, or you may have oropharyngeal cancer and not have oral cancer, but it's all connected in one. And I would be remiss if I don't say that infections with HPV is a major risk factor for oropharyngeal cancer as well, rather than oral cancer. And that's a work in progress that we're trying to get some information with and starting to work with the section, hopefully in the next year, some information on HPV and HPV vaccinations and how to go about that. So I'm looking forward to that partnership in the future in the section as well. Untreated gum disease. It's been researched and often caused by smoking, has been linked with stroke, high blood pressure, heart disease, and dementia. So warnings and dangers of hookah smoking. So one of the things that ADA likes to do, the American Dental Association likes to give out information to those clinicians and civilians that many people who are using hookahs assume that this is a safer form of smoking. So what that looks like is they're going to the hookah bars and they're going to the hookah lounges and they have the hookah pens, thinking that it's actually helping them with, the helping them. It has more benefits than actually smoking a cigarette or a cigar, which actually that's not true. And it's been researched and looked in the Journal of American Medical Association, saying that it's still linked to gum disease, dry sockets, cancer of the head, neck, and mouth, and other serious conditions. And the scary part is the World Health Organization has linked it as smoking a hookah is the equivalent of smoking 100 cigarettes based on the duration and number of puffs in a smoking session. And so when I looked and dig a little bit more on that, I was like, wow, let me figure out what that means and what that look like. And basically, when you have a cigarette, you have 4 or 6 puffs, or you have one cigarette and it's gone. You're done for now. Well, with the hookah, you can go on and on and on endlessly until eventually you have smoked a whole hookah, I guess, pipe, and now that you have the equivalent of smoking 100 cigarettes. So I didn't even think about it like that. I was just like, wow, that's very interesting. So um, it's very important for clinicians to be able to tell patients that this is not a healthy alternative. It still has negative impacts, and ADA want us to be able to convey that message. Is vaping safer for my dental health? Around 8% of people in the US use e-cigarettes, one poll that ADA had. And it shows that research that smoking and smokeless tobacco products are harmful to dental health. Anything that contains the nicotine, and most of the products does, which are highly addictive and known to affect brain development in children, teens, and young adults. And even when I was working in a pediatric practice, I was having conversations with parents and children about vaping. Um, I think the youngest was fifth grade. I had a fifth grader say that they were sneaking in bathrooms and vape pens were cool, and had to have a serious conversation with mom about what that looks like, and really conveying a message that it was not safe, and that on top of that, this affects brain development and other things that are going on in a possible 10-year-old child. So the ADA is concerned about how they are marketing this. They make it seem cool. I'm pretty sure all of y'all know the information about how they're making it very, very attractive for children and teenagers and young adults to be a part of, to indulge in these products. And so the idea is that ADA is trying to come up with strategies to, be more informed, with having parents more informed on what's out there, and strategies for preventing deaths and diseases caused by tobacco use. So, because of the oral health implication of tobacco use, dental practices may provide a unique, effective setting for tobacco use recognition, tobacco use prevention, and tobacco cessation. And I will say, as a clinician, these are things that we take the opportunity to have when we have a patient in our seat. There's so many negative impacts on teeth, oral health, and overall health that it's a great opportunity that when we have a patient there to actually go through their medical history, ask them questions about their past histories. Have they ever been a smoker? Have they ever smoked before? Are you currently a smoker? And doing it without being shameful, having an open conversation about what we can do to prevent it. And if they are willing to be on the journey to quit and agree, let's give them the resources that they need so that they can be in that, to start that journey. Dental professionals can help smokers quit by consistently identifying them in the chair and then advising them to quit and offering them resources for treatment. And also, there's a code that you can even use that dentists can even bill for tobacco counseling. And so it's an opportunity to kind of be even more of an incentive that if you talk about this, dental hygienists or dentists, they can actually bill for that service. So, the dentist's role in preventing tobacco use, dental professionals should be fully aware of oral and maxillofacial health risks that are causally associated with tobacco use. And again, this includes the higher rate of having tooth decay, which are cavities, receding gums, is what I was saying, with the bone loss and the gingivitis, and then mucosal lesions is the inside of your mouth, that soft tissue damage, bone damage, tooth loss, jawbone loss, and many more. Dental professionals can routinely screen patients for tobacco and non-tobacco nicotine use by providing counseling and then helping them to be quitters of tobacco, and then also prevent first-time tobacco use as well. Dental professionals and health organizations should provide educational materials to help prevent first-time use and encourage those current users to quit. And then also, as y'all know, finding trusted, reliable educational materials that are developed that are not linked to any kind of affiliate or tobacco industry. So those are the things that I think of when, as soon as I see a patient will walk into the door, I'm looking at their teeth, I'm looking at their health, I'm looking at how they're talking to me and all the things. And as I'm looking at them, I see yellow staining. I see an opportunity to say, let's see if they have some other things on their medical history. Let's see if they've marked tobacco usage. Okay, now let's talk about what we can do to see how difficult it is to get on this journey. What does that look like? Let's give you educational materials and let me inform this patient of the negative impacts of tobacco use. And that's kind of how we walk through the process, and ADA supports that. So like I said in the beginning of the whole presentation, is that when you have somebody that is, a lot of times you think of your medical provider to be a resource, but your dental provider is a resource too. And I can even go further to say that dental hygienists are trained to talk about it, and then dental assistants can be able to give the resources as well. So this is a healthy slide, I like to say, but quitting now leads to a healthier life. Just to knock out the big points here is that you have to have a plan, setting a quit date, develop a plan. These are the steps that ADA say to take as far as helping someone and assisting them to quit. Don't do it alone. Tell friends and family you decided to put cigarettes down for good and plan to spend time with people who want to see you succeed. Staying busy, working out, creating healthier habits. Chewing sugarless gum is actually a good way to combat to get on the journey for quitting. The sugarless gum will help plaque not be built up on your teeth, and it's an opportunity to keep your mouth moving, keep it busy. Avoiding triggers, that means staying away from people, places, and things that tempt you to smoke. I would say that, common triggers are stress, and that's a common trigger for a lot of things for all of us every day, but do as best as you can to reduce stress. Alcohol usage, coffee, hanging out with others who smoke, those are triggers that you want to avoid. And then reward your process. I mean, every hour that you don't smoke, is an hour worth celebrating. I was telling you guys, my dad is a current smoker, and he's on the journey to stop smoking as of last month. So he's working really hard to gradually get to the place where he can be without it. He's a spry 71-year-old young man, and we are in the process of all assisting him and helping him and staying on a plan. And it works. I mean, he's done a lot better. So having the things and the plan set in place, I can attest that it does work. It does get you to a healthier lifestyle. And again, I like to put it out there. Be sure to ask your dentist for suggestions. If you go, I know most people go to their medical provider pretty often, more so probably than the dentist. But if you are sitting in a dental chair and you know someone that does have dental work that needs, and they need help and they need advice and they need resources, tell them to talk to their dentist. These are trained professionals that know the impact of tobacco use on teeth, oral health, and overall health. We care, we can offer guidance and motivation to help you succeed. Again, I'd be remiss if I do not mention the South Carolina Tobacco Quit Line. This is the information that we have for South Carolina Tobacco Quit Line, with the website there and the number. And again, I'm sure as you all know, it gives free 24/7 quit support to all South Carolina residents and have free over-the-counter nicotine replacement therapy products. I think it's a very good resource. I sit with a committee, a few committees in DPH, and I love to hear when they talk about the quit line and what they're doing with that. And she's always like, bring them to me. We should be always on the phone helping people quit. We should always be on the phone, and the energy is unmatched. So again, I would be remiss if I don't even put this in the slide deck, that if you have any need for resources, this is a great one. Again, a lot of my resources and information come from ADA, the American Dental Association, and their sub-partner, Mouth Healthy. These are the links and the information that are connected to the things that I spoke of today. In my future, and in a perfect world, I would love for us to have our own tobacco and smoking and oral health resources. I'm hoping that eventually, when we have more personnel and time, that we'll be able to kind of dedicate more time to putting some meat and potatoes on tobacco use and oral health, because it is a thing, especially now with electronic e-smoking and all of those things that come with that. So I am excited about a future partnership with the tobacco section. But this is my information. If you need to reach me, Tara has my information. Again, thank you, Deborah, for reaching out to Mike, who is my director, Michael Treadway. And that is what I had for today. I can't see any of your faces because I had to minimize to see on the Zoom screen. But if you have any questions, please, please, please ask away.
Thank you so much, Michelle. That was great. A lot of good, valuable information. I'm glad your dad's on his quitting journey. We always tell people it's never too late. So
Never too late, never too late. And he's working very hard. So thank you. Thank you, thank you.
sure, yeah. My mom is also a smoker, and she is only 59 and has a full set of dentures on top, and her bottoms need to go too. So it's crazy how early that can happen. From she started smoking when she was 15. So just that
Yeah,
lifetime of smoking is terrible for their mouths. All right, I think we have a question from Dr. Keeley.
sure.
Yeah, hello, Michelle. Thank you for that very informative presentation and your energy. And likewise, I'm rooting for your dad to, be successful. Is he doing some, you know, behavioral, you know, conversations through the quit line, or is he doing that elsewhere?
Well, a lot of the things that he has he's been doing it through the VA because he used to be a part of the Air Force. So a lot of the resources and things that he has come from out of that. I have shared the quit line, and I would lie if I know if he actually called and actually
Mhm.
listened to those resources. But no, I think that I need to reignite that and see if there's anything that I can do as far as that behavioral piece for sure. So
Okay,
thank you for mentioning that.
sure. The question I had, what have you, in terms of linkages with our South Carolina Dental Association? The ADA nationally is, great. And if if yes, who have you been in touch with at the South Carolina Dental Association?
So what we do is we have a liaison. Her name is Mary Kean Jones, and
Okay.
she works with the South Carolina Dental Association with Phil Latham and on the board as well, speaking to them. And so that what she's done lately is, like I said, has been much of little because we haven't really built and had that strong partnership since I've been on board since 2021. Yes, sorry, 2021. So I think there's more that can be done for sure. I would love to connect with somebody from SCDA, or get her in cahoots with somebody so that we can continue to get some good information out for oral health. If you have a connection, Dr. Keelan.
Well, I asked that question because I'm looking for the same thing,
Okay, okay.
the WHO. So maybe we can work together. You know,
Yeah.
I'm a strong proponent for expanding South Carolina Medicaid under the ADA, and that mainly is going to help working adults. And I know dental, coverage is limited under Medicaid, but we're trying to, I'd like to make that connection not only as Tobacco Free York County Coalition, but also as part of the Cover SC Coalition that's trying to get Medicaid expanded. So
Would
maybe
love
if,
that. I would love
yeah,
that
if you'll put your contact information in the chat, then I'll follow up with you.
for sure.
Um, all right,
No, that would
great.
be great. And we're in the process too. Sometimes we like to highlight as best as we can. We try to highlight the benefits of adult dental benefits for us because South Carolina is one of the few states that actually have adult dental benefits. Not kids are usually the forefront, but South Carolina actually takes care of a good bit of procedures like simple fillings, extractions for and dental cleanings a year for adults. And so just expanding that a little bit more and talking, but absolutely, yes, I think Mary Key and Jones would be a great connection for us to talk to see who we can talk to with Phil Layton at SCDA for sure. Put it in.
All right.
Thank you so much.
Yeah.
Yami, I apologize if I said that wrong, but I see your hand is up. Do you have a question?
Yes, hi. Hi, Michelle. Hi, everyone. Just to introduce myself real quickly, I'm Yomi, and Michelle was a good presentation. The visuals were very direct and spot on. I'm actually the surveillance coordinator for the tobacco division within DHEC. The only comment I would have just said is um, it would have been nice to have a little bit of visualizations, pretty much like pie charts or bar graphs. So for the future, if you ever need those, please feel free to reach out to me. Mine is more of a comment rather than a question. And I'll be glad to use my expertise when it comes to using SAS or Tableau to provide you with visuals, be it using some of your Excel spreadsheets or whatever survey collection data that you might have. I'll be very instrumental in doing that moving forward for the future.
Yes, please. If you don't mind, could you put your contact information in the chat and I can grab it from there?
Sure, we'll do that. We'll do that.
Thank you so
Not a problem.
much.
You're quite welcome.
No, that's great. I think everything needs data, evidence, and things to back up, and it needs to be beautiful as you present it. And I think you guys are the ones that can assist in that. And ideally, like Dr. Keeley said, is just trying to build partnerships and trying to kind of build some bridges together in any way that we can, especially now. So yes, thank you so much.
Correct.
Much
Correct.
appreciation
You're quite welcome.
to you both.
Hey, I was going to mention this is Kelly Lamb from American Cancer Society. I jumped on late, so I do apologize. I missed some of your presentation. So it might have been mentioned. I cover a few different states besides South Carolina. I'm working with 2 now. And piggybacking actually on one of my coworkers that did it with Indiana, but they put together a toolkit for dental health providers to promote tobacco cessation and HPV vaccines. Now, some states, a dental provider can give that vaccine and some can't. So we're tweaking that as needed, but using this toolkit to provide to providers, dental health care providers, on the importance of cessation, how they bill, resources, things like that. Do you offer something like that already for them?
No, unfortunately, we don't, Kelly. I was sharing with them earlier that we've kind of not have been working very heavily with tobacco. We're just now getting in the works to where we are looking for more HPV grants and things so that we can get more involved with that. But tobacco has not been one of the things that's been the forefront. But I love it. I love having the thought of having a toolkit for the dental professionals and providers. And you are absolutely right. There are some states that can vaccinate, and then there are others that you kind of can't and got to navigate around that. But I still think, like you said, it's an opportunity to still give out HPV information in a way that is not, lack of better words, y'all, sexual. You know what I mean? That trying to market it as cancer prevention instead.
Right.
And then also more information about tobacco cessation as well with the e-vaping and a lot of that, because it's getting the ages are getting younger and younger. I can't tell you now. Before, you used to see this information in general office, but no, it needs to be in pediatric offices as well. So yeah, I love. Do you know what states the 2 states that you work with? I think you mentioned it, so I'm sorry if I missed it.
No, I didn't. Oklahoma and Arkansas. So I
Okay.
cover those 2, Mississippi and South Carolina. So Indiana was the one that initially started it.
Okay.
And they actually held like a whole dental webinar conference and stuff, but trying to kind of rally some of that. So maybe I'll reach out to you. I screenshotted your email, and I'll reach out and maybe to Dr. Keeley. I think it's something obviously we'd have to bring DHEC in on and their approval to promote the stay put line, but it's simple. It's already put together. We would just navigate it to towards what South Carolina can offer and do. And maybe if we could get the Dental Association to share it with their members, It's just an easy way to educate and for them to have access to information. But yeah, I would love to work with you on that if possible.
Of course. No, I think that's great. I think that's wonderful and doable.
Yeah.
Gotcha.
Well, thank you for being here today.
Of
Great
course, of
information.
course. Thank you.
2 more hands raised. Yomi, do you want to go? And then
Oh
we can
no,
go to Kim.
I think it was just
Oh, yours just didn't go down. Okay. Sometimes I don't understand, like they'll go down fast and then other times they stay. Kim Caldwell.
Yes, good morning. Thank you. Thank you for your presentation, Michelle. This was really good. I actually got the information of today's call from my colleague, Shayla Compton, who actually is in your backyard in South Carolina. I'm in North Carolina, and we both work for the Center for Black Health and Equity, which is a national organization. And one of the areas that Shayla and I both work in is in the tobacco control space. So your presentation is very timely. And Dr. Keeley, I think I owe you an email. So I just,
Okay.
I saw you here and I was like, I think I owe you an email. So I do apologize. You know, one of the things that came up for me is education campaigns. And I don't know if that's something that can be developed in your wheelhouse. I know that oftentimes that does come with some cost. But perhaps you can run an education campaign on your social media for about 30 days just to get some information out, targeting the young people. This is a good time of the year with back to school. So you could work with Yomi, who just, you know, graciously said he can give you some data and some analytics and make those, you know, make your data come to life without you having to work so hard. And if you do have a communications department that can, you know, come up with some imagery and you have the messaging, then I believe this can reach an audience to give them some informed information around vaping, and all these other products too. I'm not going to name all of the products, but whatever specific product you are looking to advertise to young people, and then connecting them to a quit line or to resources that can, you know, help your department really gain some traction. And this will also help you work across the aisle with the folks in the tobacco control branch. That's just an idea. But we're happy to help here as a national network. I do oversee a project that's specific to tobacco and cancer, but I didn't want to take up too much time about that project, but we're certainly here and available to assist you.
Thank you so much. I was writing and writing and writing, so I wasn't looking, but no, this is great. Thank you so much.
Absolutely.
Absolutely right.
Kim, if you ever want to present in this forum on our Tobacco Free Partners Roundtable about that initiative with cancer, you're more than welcome to do that. That way
Absolutely.
Yeah.
Yes. Thank you.
Okay.
I'll put my information here so you can reach out to me.
Will do. Thank you.
So I do have my hand up again this time around, so it's not like it's hung up there. And I just wanted to reverberate what Kim has just discussed now, because she just gave me a light bulb moment on some of the discussions we'll be having. So based on my role in the surveillance and evaluation section, we've been having some issues, especially regarding the educational aspect. Especially since we are currently seeing a trend in middle schools and high schools and pretty much that age range between 15, I believe, to 19 when it comes to electronic nicotine disposers, short form for the vape products. It's a very common trend that we are beginning to see. But some of the challenges that we've been having has had to do with having the schools participate in the surveys. This is the YTS survey, which is more like the youth tobacco surveys. It seems like it's a very large project that would require all hands on. The issue that we're having is more of like collaboration or cooperation with the educators involved, like school principals. And I believe that's got to do with more of the political aspect and the blowback of parents feeling their school is being labeled as a smoking school, or where you have a prevalence of students that actually use these products. So we were just discussing a few days ago if we could have some sort of quarterly uh, educational program where we have educators log in, and smoke free actually came to mind, whereby it could be like a 45-minute to an hour virtual educational program where we could and we would my section would definitely gladly provide you with some of the trends that we are seeing, especially when it comes to highlighters that look like vapes. Is it vape? Or it's the other way around. Vapes that actually look like highlighters. And these actually go on undetected. But some of the major trends that we are seeing within that age group of high schoolers and middle school students, I will be glad to provide you some of the visuals of what those look like. But it's still in the works for us to see if we could have smoke free provide it, which will be in collaboration with DPH, provide educational 1 hour educational virtual discussion where we will have um, principals join in, and they could, because we did see a trend. Every single school that we visited, from upstate to middle state to Midland to this is the lower region, all of them all had vaping issues at the school. Not a single one said it's not a problem in our school. But getting them to participate in the survey was what the problem was. So with that said, I don't know, maybe I might have given anyone a light bulb moment here, but we were not able to meet the capacity of schools that were required to fill the survey in the last YTS. Not because vaping or smoking wasn't an issue, but just because the schools just didn't feel like they should participate in the survey because they felt like there was a stigma attached to it. So with that said, we are open to collaboration, ideas, connections to principals, educators within those regions. And we feel those vape talks would be a good avenue to keep that community connection and that discussion ongoing, where people would actually feel less threatened with the vape talk issues that we're currently having. I know it was a mouthful, but it just shows the passion of how this has been ongoing for a while now. So thank you guys for indulging me on that. Thank you.
Thank you for sharing. I'm surprised so many of them said they didn't think it was an issue in their schools, because when we go to schools to do our vape talk presentation, they're begging us, like, please, we have an issue and we don't know what to do about it. So I bet it was that stigma associated with it that they were more worried about. That's a shame. Kim, do you have another comment?
I do.
Perfect.
I dropped a link in the chat. It's the most current monitoring e-cigarette use among youth. I mentioned it directly to Yomi if you have this resource, but it's for everyone that's on this call as well. Just provide some data around e-cigarette use, but it does validate what Yomi is saying. However, this particular resource shows reductions in certain populations. And so it's not very inclusive of all populations of youth. And so here as a national network, we work with 8 other networks that have specific populations of focus, and we do see that data disparities are happening across the entire country. But here in North Carolina, Yomi, we have some of those same challenges in the school systems. But I just encourage everyone that the more we say internally that the schools do not want to participate in these surveys, the industry knows this. So if you flip it around, if I work for the industry and the parents are just going to kind of bury their head, then I'm going to keep producing products to harm young people. So we have to find a way to really get this information into the schools at an appropriate way, but also working with your state, your school boards to encourage them to talk with their superintendents in the Department of Education to ensure that there's funding available for these surveys. So funding may look a little bit different in South Carolina, but if they talk about reductions in funding, then this is the one that's going to get cut. This particular survey. But we do see disparities across the states as to who is completing the surveys and who are not.
Thank you for sharing. It's nice to know that we are not all alone. We can work together to try to get that out. Dr. Keeley, I see your hand raised again.
Yeah, I really, we had last month, we had a great presentation about the various products, commercial tobacco products. And I've got to ask Michele, these new nicotine pouches, from what you showed about the science of, gum effects, gum retraction, your slide said tobacco smoke, but also, I think they also were talking about chew tobacco and dip. What kind of pivots are you making to include Zyn and the new, because just talking about schools, we've got big time concern in all our districts in York County, and kids are switching over, from vaping to the Zyn, and so they're continuing to be nicotine addicted, and so what kind of things have you talked about or been thinking about, and maybe that you could tell us now?
I don't have any resources as far as like specifically towards Zen. I know with ADA, they take it from, they create the policies and things that they want the dental professionals to kind of advise patients based on nicotine containing products. But I am very interested now to see what Zen exactly can do in this negative effects. I think once I get off of this, y'all have definitely given me some good homework. And I definitely want to be able to prepare to say something specific for Zen, because right now there is no policy or anything on ADA's website or with Mouth Healthy with Zen. And I think if anything, I need to find out what that looks like, and then also see if I can request that information and probably start from state to national. So no, I think this is good that you brought it to my attention, Dr. Keeley.
Yeah, and if you can incorporate it just right into your presentation, that would be great. Maybe even before you share your slides with Tara, maybe even you're going to make some. If you learn a couple of things, you can go ahead and either tack it on the end of the slide deck, or go ahead and work it in. Yeah. Because your information, that slide deck's great, so love to have that. Yep.
Well, absolutely. Thank you so much, and thank you for bringing this to my attention. And I see what the chat is saying too. Kids love, yeah. So yeah, it definitely needs to be a component of the slide deck.
Yeah, it's one of those new scary emerging products that are gaining in popularity. I don't know how many of you were at our summit back in April, but one of our speakers was from Tobacco Free Kids, and they're a national organization that works on tobacco prevention and control with a focus on youth. And our presenter was talking about social media accounts and how, different manufacturers of vapes will pay and buy, ad space, or they'll pay influencers to promote their product. But Zen was actually the highest in terms of organic social media marketing. So that just meant they weren't paying people to promote it. People were just promoting it themselves on their personal social media pages. And that was a big factor in its popularity the past few months, how it's just really grown exponentially on social media. So that's also scary as well. It's being promoted without people even being paid by them. Yeah, Kim just shared a link about Zinfluencers.
That's
Yep.
awesome.
Yeah, it is. So we're almost at our hour. I would like to say, I know we mentioned this a little bit in some of our presentations, but just getting information to principals or to schools about vaping and the harms of nicotine, not even just vaping, but just nicotine in general. Some of you know this, some of you don't, but Smoke Free SC has a vape talk presentation that we give for free to schools. We give it to youth, we give it to adults. Whoever wants to hear about the dangers of nicotine associated with youth, we'll give it to them. Deborah Dunbar, who's on the call, and I handle that presentation. So if you're interested in scheduling one in your area, or if you know someone who needs to hear it, just reach out to us and we can get that scheduled. It is a great way, especially for parents and maybe educators who think it's not an issue. If we include data from the South Carolina Youth Tobacco Survey, we talk about what we see, what teachers tell us. So it is a great way to really just inform people who don't think it's an issue that it is an issue and why they should be aware of it. So if you want more information on that, feel free to reach out to Smoke Free SC. That information's on our website. Like we always do, this presentation was recorded, so we will put it on our website for you to view. Michelle, I'll reach out to you about sharing your slides because sometimes we link those if you're able to share. I'll link those. We meet every fourth Friday of the month. So next September 27th is the fourth Friday next month, and we are having another representative from the South Carolina Department of Public Health, Kimberly Gripper Sims, who's in the Tobacco Prevention and Control section, but she is the director of the statewide Baby and Me smoke-free program. So she'll be our guest speaker, speaking about what's being done in our state to help pregnant mothers become smoke-free and tobacco-free. So we hope to see you all then. Registration is always on our e-newsletter, so hopefully you get that. And if you don't get our e-newsletter, you can sign up for it on our website as well. If anyone has anything else they'd like to share, you're more than welcome to do so. But if not, thanks for joining us, and we will see you all. Oh, Dr. Keeley, sorry.
Yeah. No. I just wanted to call out the fact that we've got, people probably from all around the state on today's webinar, which is great. And for the school folks, or for in your county, the schools are required to have a comprehensive health CSHAC, Comprehensive School Health Advisory Council. And I really recommend that you take this information, Michelle, and the vape talk information, and get on the agenda for your local CSHAC. And then they can make a recommendation that you could take that same information directly to the school board. So it's a two-step thing, CSHAC, and then ask them to give you an opportunity to speak to the school board. And that can really engage them, with how, and give them some hope because they are really struggling with the kids and these nicotine products that are being marketed. So just a final thought. Thank you.
That would be great to reach out to those committee members.
Yeah.
Great way to get information to the district, which is sometimes harder for us to reach.
Right. Yeah. A coordinated school health advisory is the official title. Yep.
Anyone else have anything to share?
Maybe even volunteer to be on the committee too. Yeah.
Yeah. I used to work a long time ago in reproductive health, like teenage reproductive health, and our organization served on our school district's committee.
Mhm.
It would be a great way to get involved.
All right.
All right. Well, thank you all for joining us. We'll see you next month, and just look for our e-newsletter. That's how you get registered for our meetings. Thank you all.
Thank you. Guys,
Bye,
have a good
everyone.
time.
Thank you.
I
Bye.
just signed up so I can get in on it.
Oh, awesome. Good to hear. We
Yes,
have
yes.
great conversations. We're all friends. You saw
Yeah.
today. We just
Right.
having good
I love
positive
it.
conversations.
And I love y'all's passion for the work too. So friendly and very much so. So I literally just hit the send button.
Perfect. And thank you
Yeah.
so much for joining us. And I know, you said in the beginning, this hasn't been on your, it's been on the back burner for a while for your section. So I do appreciate you agreeing to it, even with it being on the back burner.
Oh, I want it to be more forefront because I feel like this touch a good range of lives, and I think it's very important for us to start thinking about what that looks like and getting more involved. Because we did have a relationship, and I hear about what it used to be before I got here, and then the COVID. I mean, let's just be
Yeah.
real. I think COVID took everything, and then it was a bouncing back from that. But I think between tobacco and nicotine use and all of this vaping and everything that y'all telling me is in and all of this, how do y'all stay on top of things? It's amazing what's new and out there every month.
You
But
think you get
I
one
think
thing figured out, and then another one
Yeah.
just pops up.
yeah.
One other thing, Michelle, that you can do, I really talk about nicotine addiction.
Mhm,
I think, now there's so many products.
mhm,
I just say we've got an epidemic of nicotine addiction in our youth and young adults. And that opens the door with Deotis, um, because the folks who are experts in treating substance use and addiction, um, so don't forget to reach out to Deotis with your information about the
mhm.
oral health and tie them in, by saying I'm working on nicotine addiction. Yeah.
For
That's a good
sure.
idea, that
Yeah.
wording.
Great. Great.
All right.
And
Dr.
now,
Kelly,
Michelle,
don't-
you
don't-
have sorry, I was gonna say you have the connection with Yomi. So if y'all are able to work together, he's
Yeah.
in the section of tobacco
Okay.
Yeah.
prevention and
Yeah.
control.
Yeah.
So that's a good
Yes.
way for y'all to get
Thank
back
you.
involved. Yeah.
Yeah.
And Dr.
Thank
Kelly, thank you for your work. Don't be surprised if we might reach out to you as well.
Okay. Be
To
happy.
let you know. Sure.
Good to
He's
love
a
to
great
work
one to
with you.
have on your
Yep.
team.
Thank you,
All
Dr.
right.
Kelly.
Thank
All
you
right.
all. Have a
Thanks
wonderful
all.
weekend.
All right.
Bye,
You
everyone.
too. Bye-bye.